Welcome back. Today I want to talk just a little bit about if I had to go back in time, like knowing what I know now, if I had to go back in time, would I still go through with having brain surgery or would I choose another route, either not do anything or get on long-term medication? And the answer is I would 100% have surgery again. Or if I had to like do over, yes, I would absolutely have surgery. I would not get on the medication. And I'll tell you a quick story about why this one very singular incident just completely solidified it for me to go the route of surgery. Now, when I had my first appointment at the hospital, I already told myself I made the decision to have surgery. I didn't ask my family, I didn't ask friends, I didn't say, what do you think about this? I made the decision for myself and I went to my family and said, this is what I'm doing and I need your support. That's it. Don't try to talk me out of it. Don't try to tell me about, the percentage of people who die or, any negative things like that. Don't tell me. Just support me or don't be involved in this journey pretty much at all. Now, the first time I went to the hospital, I was actually seeing an endocrinologist, not the neurosurgeon at that point. I was in the waiting room and there was another patient in there as well. And she and I got to talking and she asked me, was I going to have surgery or the medicine? And I was like, if they deem me a good candidate for surgery, that's the route that I'm going to take. And I was like, what about you? And she said, I'm on the medication and I wish I would have had surgery. And I was like, oh, I was like, do tell. And she said that she had been on the medicine for maybe 6 or 8 months at that point, and it just completely changed her as a person. She became a shell of herself. You hear things like that when people get on certain medications for mental health issues, that they just become like a zombie and stuff. So she said that that's basically how she was, and she was very depressed and all these other things just started happening. And now she was trying to figure out how she can wean herself off of the medication. Because I think, do not quote me, remember, I am not a medical professional. I am a patient who had surgery sharing her experience. But I'm pretty sure if you get on the medication, you can't just get right off of it. If you want to get off, there's a process for like weaning yourself off. So that's where she was in her journey. She was trying to get off of it. And in some cases, I believe if the medicine doesn't work, then you can pursue surgery. But it's kind of a case by case basis. It depends on your tumor size and if it's affecting, let's say, your carotid artery or, something like that. So it's not a black and white type of thing. But yeah, typically people will get the medicine, and if that doesn't work and they're able to, then they'll have the surgery. And so she was saying that despite how scary it is, because brain surgery is scary, that she wishes she would have done that. And that one patient telling me that, I was like, yeah, this is the right, decision for me. Would I take that approach with other situations? I'm not saying that I would, but in my soul, I knew that this was the right choice for me. So, I'm glad that I was able to pursue that route and have it. So now, if I had to do it again, I would absolutely have surgery again. I know all the pain to expect. I know the discomfort. I know everything about it. And I still would not get on the medication. For some reason, long-term medication just doesn't sit well with me. I pray that I never have to get on any kind of long-term medication, and I try to live my life as best as possible to get myself, or to put myself in the best position to do that. I know firsthand that, nothing in life is guaranteed except the fact that we're all going to die one day. You're not guaranteed to never get sick or to anything like that, but I try to align myself with what I want. So if I want to avoid long-term medication, I'm going to keep myself as healthy as possible to do so, So, yeah, I don't want to get on any type of medication. Now, my other option really could have been to do nothing at that point, because the tumor, it was causing issues, and the issues were going to progress. Like, this wasn't a situation of I could change my diet and, the tumor could shrink, or it was nothing that I could really do to make it go away. So I could have just done nothing and let it sit there, and it would have continued to grow. It would have caused more problems, and then it probably would have gotten to the point where I would have had to do something. But that could have been a year out. It could have been 2 years out. I mean, I just don't really know. Did you all hear my computer? I'm sorry. My apologies. But where was I? The tumor. Oh, uh, anyway. Damn, I forgot where I was again. Oh, I could have not done anything. So I could have, it wasn't a life-threatening situation at the time. And this never really would have become a life-threatening situation. And most likely it never would have turned into a malignant tumor. It was benign, but it would have caused more issues. But what I'm saying is I had a little bit of time to decide. Like, if I said, well, I want to give it 6 months, I want to give it a year and wrap my mind around it and then come back to this, I definitely could have done that. And then, for some people, they don't want to do anything at all. It doesn't matter if it's, you know, progressing really fast and it's like you have to do something. Some people are like, no, if this is how I'm gonna go out, this is how I'm gonna go out. So I could have done that. I didn't want to, obviously, but looking back, I still wouldn't have done that, which is done nothing. I would not have gotten on the medication. Another thing, knowing what I know now, if I had to go back and if I had to have surgery, but it was a craniotomy, which is where they take a piece of your skull off and they access your brain like that, would I do it? And the answer is yes. If I had to have a craniotomy, I would do it. And this is another layer. For some craniotomies, this wouldn't have applied to me, but for some craniotomies, they wake you up during the surgery and they ask you to talk to them, to like move your hands, move your toes. I know there was a case of a musician who had brain surgery and he was actually playing I want to say his violin as they were operating. Basically, if you're able to play your instrument or you're able to talk or move, they know they're doing the right thing. So it's reassuring for the surgeons. But if I had to go that route and they had to wake me up in the middle of it, I would do that instead of the medication, instead of just doing nothing. Obviously, I am in no means trying to speak this into existence, but just talking realistically, and especially if anybody watching is going to have brain surgery, and you're wondering, for a patient who has gone through it, do they have any regrets or anything? No, I have zero regrets with this. This was one of the best decisions that I could have made. And I'm also, let me say this. It was a much easier decision to make because I'm in such close proximity to the hospital I went to. I went to Johns Hopkins in Baltimore. If I was in another area, I would definitely rethink it. And also, I would say that I would travel to, the best surgeon that I could find, but that can create difficulties as well because a lot of insurance companies or your insurance policy typically is regional. So let's say you are in Nebraska, and you find out you have a brain tumor, the same type I had, and you're like, I want to go to the best, I want to go to Johns Hopkins. You may not be able to because that's out of your region, out of your network. So if that was the case, I don't know. Maybe I would make a GoFundMe. Like, I have to have brain surgery. I want to go to the best doctor. He's not in my network. I'm going to have to pay, I don't know, $100,000 out of pocket to pay for this. I really don't know what I would do in that case. But if I had to go back in time and I was still in this area, then yes, I would have whatever kind of brain surgery I needed, going through the nose, going through the skull, the outside of the skull, I would 100% do it again. So it would be it wouldn't even be a hard well, it would be a hard decision. Let me not lie. It's a very serious decision, but I think it's worth it. I think it's very much worth it. And the transformation that I've had is, sometimes it's a little difficult to put it into words. It's just been amazing. The highs, the lows, everything in between, everything I've learned, what I've given up, what I've had, like everything surrounding this has been 100% worth it. So if you have to have a brain surgery coming up and you have any questions or, things that you're concerned about, anything like that, feel free to put it in the comments. If you want me to make a video about something else that I haven't already talked about, I would absolutely be happy to do so. So yeah, I'd have brain surgery again.